Hi guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. As always, for you are doing a bit of a reading. Again, Dr. BKM does not create question papers. We just tell how to solve question papers in the easiest possible way. Like if in this, I would let you know about question number 5. Let's see how it goes. What point is made about carboxyhemoglobin level? This reading I am recording because I know this reading is very difficult. So I need your 100% attention. But if you would learn this, then you would be able to pass OET exam for sure because it's a tough reading. Okay. But again, we will make it easy. What point is made about COHB levels in the fifth paragraph? So I'm just going to read the fifth paragraph and we'll try to sort it out. Okay. Yeah, it's a big reading. 1, 2, 3, 4, 5. Behave like kids. It's always okay. Okay. Patients that again, it's a tough paragraph. I'm telling you because I've done this reading. I already know about it. Patients that present with the low carboxyhemoglobin levels correlate with the mild symptoms of carbon monoxide poisoning. That means the patient who are having low level of poisoning, they have mild symptoms. Correlate means that they are having similar kind of less poisoning. That means carboxyhemoglobin, that means in the hemoglobin, carbon monoxide is less. So obviously symptoms should be less. As do cases that registered levels of 50 to 70%. And the same happen, as do means the same happens in the cases of 50 to 70%, which are generally fatal. Fatal means lethal. Lethal means deadly. Fatal, lethal, deadly, mortality rate, death rate. Fatal, deadly, lethal, mortality. So this particular a line was difficult in itself, that if you have low carboxyhemoglobin level, symptoms will be low. The same happens when the carboxyhemoglobin level are 50 to 70%, and those cases are generally fatal. That means if the level is high, the symptoms will be high, deadly symptoms. If the level is low, the symptoms are low. Read this line 10 times to improve your reading. However, intermediate levels, that means moderate levels, show little correlation, means no correlation. Little means very less. Little correlations with the symptoms or with the prognosis. Moderate case, however, do not have the same kind of symptoms. Means in the moderate cases, the symptoms can be more or symptoms can be less. That is the meaning of these three lines. Tough lines, but please learn it. You need to learn this line. Reading this line will help you to develop reading habit in the nice way, that patient that present with the low levels correlate with the mild symptoms, as do the cases that register with the 50 to 70%, which are generally fatal. However, intermediate levels show little correlation with their symptoms and their prognosis. Then it becomes possible to understand this line. One thing that is certain means sure. Certain mean is always sure. Always take care of this word. This is also an adverb. One thing that is certain about carboxyhemoglobin level is that smokers present with higher levels than, this is sure that smokers will have higher level of carboxyhemoglobin. The carboxyhemoglobin levels in the non-smokers is approximately 1 to 2%. The people who does not smoke, their carboxyhemoglobin is only 1 to 2%. In the patient who smoke, baseline level of nearly 5% is considered normal. If a person is a smoker, then 5% carbon monoxide in the hemoglobin in the blood is normal. Although it can be 13% as well. That means in the people who are smokers, 13% is also normal without any poisoning. Although carboxyhemoglobin concentrations between 11% and 30% can produce symptoms. Although carboxyhemoglobin concentrations between 11% and 30% can create symptoms. Smokers are generally having level of 13%. And if there is any poisoning, if there is any carbon monoxide in the room, then 11 to 30% intermediate levels can also produce symptoms. That means in case of smokers, you will never be able to recognize whether it is poisoning or is it normal. It is important to consider patient smoking status. That is why it is important to consider. So I hope you all have understood this difficult paragraph. But again, you have the recording. That is why I recorded it. Please listen to it again if you have not understood anything. In the what point is made about carboxyhemoglobin levels? Guys, what point is made generally asking that in the cases having low carboxyhemoglobin level, the symptoms are correlated. In levels with high, they are correlated. Moderate levels, they are not correlated. Okay, that is what we learn. They fail to detect carbon monoxide poisoning in habitual smokers. It can be one of the figures. It can be, because they were saying in the habitual smokers, it would be 13% as normal. So indirectly, they may fail to detect carbon monoxide. It can be answers. It can be answered. But again, directly this point was not given. So at least I am holding for this second. They are generally a reliable indicator of carbon monoxide poisoning. No, they are not reliable indicator, because in the moderate level, they are not reliable. In smokers, they are not reliable, because in smokers, only carboxyhemoglobin level can't tell you. So suppose if there is a person who is a smoker, 13% is normal, then how can you rely upon this data that he is having carbon monoxide poisoning? So you can't trust this. So it is not a reliable. And also ly words, that is our adverb was given. They are a generally. So ly word will help you in the final exam to eliminate. If you cannot understand that level, at least notice this ly word. They correlate very well with the extreme levels. Oh, this was surely given. This was surely given. As do the cases in the fatal. Fatal means extreme cases, they are correlating. This surely is right. They are most useful, again, superlative degree is given. Most, best, again, degrees. Three things I always tell you. Again, see all my videos, grammar, degrees, adverbs. Watch these videos after every questions, every recording I do. So answer should be C or A, but C surely is right, because carboxyhemoglobin level, as do the cases that register with 50 to 7, which are generally fatal, that means are very well with the extreme levels. Extreme also means low and high both. Extreme does not always mean severe. So yeah, but anyhow, in severe cases and in both the cases they are. And this point, then I will eliminate that it is not directly given. Okay. So answer should be C. Can you tell me the answer, guys?
C, sir.
Done. It's a hard question for me, trust me, because I remember I have done this reading priorly so many times, but I'm a kind of a person who generally don't remember the answers. So I get confused between A and C. And that is exactly what's going to happen in your final exam. Ly word, adverb, when generally means, then it should have been given. Generally means usually, frequently, often, something like that should have been given. Most means superlative degree, the best, the most, the greatest. So then you are stuck between A and C. Then in the final exam, you just only see they fail to detect. Is it given they fail to detect carbon monoxide poisoning in the habitual smokers? Let's see the last two lines. Habitual smoker while lines. Let's see whether it is given. It fails to detect. One thing is that smokers present with higher levels. The carboxy in the no smoker is only 2%. Baseline is 5 to normal, although it is normal. Although carboxy between 11 to 30% can produce symptoms, it is important to consider patients. They were just saying it is important to consider. They never said it is they will fail to detect. Simple elimination. Then you reach to C option. Then you understand extreme level means high level. High level means fatal. Fatal means that patient present with correlate well with the mild symptoms, as do as do cases that register with fatal condition. That means extreme condition. Then you realize they are correlated. Again, maximum manipulation would be done in the right option, that is C option. Okay, I'm doing this in the flow, as I hope you are enjoying this reading. Even the YouTube followers who are watching this video, I hope they would have learned good. Now I will try to do one more question for you in the same. Otherwise, I try to keep my videos short. The phrase one such factor in the sixth paragraph refers to one such factor. Okay. Regardless of the method of detection. Okay, I'm just going to mute you, otherwise it can cause trouble. Sorry. Yeah. Regardless of the method of detection used in the emergency department care, several other variables means parameter. Regardless of method means any method that you use for detection in the emergency department, several other variables make assessment of the severity of the carbon monoxide poisoning difficult. Whether the carbon monoxide case is severe or mild or moderate, assessment is difficult because of several factors, several variables. The length of time since the carbon monoxide exposure is one such factor. Now tell me, one such factor means one such factor means one such. See, again, I will tell you how to read. Several other factors, several other variables make assessment difficult. The length of time since carbon monoxide exposure is one such factor means is one such variable. So what is variable doing? It is making the assessment of severity of carbon monoxide difficult. That means if I go to the option, that means it is a cause of difficulty that is causing the assessment difficult. So it is a cause of difficulty. It is not a method of detection. Anyhow, please understand, they are saying time is one of the factors. Suppose if the patient is having carbon monoxide poisoning, he comes after 2 hours, there would be less symptoms as compared to exposure. He comes after 4 hours, symptoms would be much less. He comes after 6 hours, symptoms would be even less. That means time exposure is the variable that makes assessment difficult. Because if 8 hours would be there, carbon monoxide would be out of the body almost. So time is also one of the factors that makes severity assessment difficult. So it is a cause of difficulty. It is not a method of detection. It is a cause of difficulty. It is not a way of making an assessment. It is a cause of difficulty that make assessment difficult. I'm just going to unmute you and will ask you if you have understood both these questions nicely. Guys, any doubt in these two questions, please?
No, sir.
Everybody. Guys, I have to teach you English right from the start, I guess. Everybody means everyone. Anybody would like me to repeat, or everybody is fine with these two questions?
We are fine.
Great. Are you sure about it?
Yes, sir.
Yes, sir.
Yes.
If you're sure about it, then you should be sure you're. Okay. One more question. I know it's hard to concentrate for such a big video, but again, who wants to learn would enjoy more. And again, teachers should teach for those who want to learn. One result of administration, or never forget these numbers. These important, these are very result. We have already done synonyms, findings, conclusion, results, outcome, lethal, deadly, fatal, mortality. Result means outcome. What is the outcome? What is the finding? What is the conclusion? One result of administering oxygen to carbon monoxide poisoned patients in transit is that, suppose if we give oxygen to carbon monoxide poisoning, what will happen? What will happen generally? Generally, guys, what will happen? Carbon monoxide poisoning patient came, we gave oxygen. Is it good or bad? Okay, good or bad? Good or bad, guys? Arey guys, you are not participating. I have to make you participate. Otherwise, you will be like sleeping angels. We don't.
No idea.
Oh, no idea. Very nice, Amandeep. At least you responded. But generally, our carbon monoxide poisoning means the body is having more carbon cycle. Oxygen is the only treatment we can give, I guess. less symptoms are different. So what will happen if oxygen is given in the transit, then the patient will become normal. The symptoms will disappear. So now you cannot judge whether the patient was of carbon monoxide. It means you can't even judge anything because it will flush out all the carbon monoxide and the body will again become vital. Okay, cool. Again, I'm just going to do this last question for the reading. Okay. Concentrate. One result of administering oxygen to carbon monoxide poison in the transit is that. Okay, let's do it. Okay, it must be over here. If a patient is given oxygen during their transit means in between. Their transport, it will be difficult to know when the carbon hemoglobin level hit its highest peak. That means the main thing is that you cannot judge when the carbon mono means when was the hemoglobin carbon monoxide, when was the carbon monoxide present in the blood hit the highest point. So this is given. If I can find this thing highest point wala, then it should be answer. It becomes hardened. Yeah, peak means highest point. So without any doubt, it becomes hardened to ascertain when the carbon. So this is how you do OET reading in the long run. No matter how difficult the reading is, go slow about it and learn maximum from it. This is Dr. Bhupesh. Please listen to this recording as many as times you want to learn. This is Dr. Bhupesh from Dr. BKM OET Institute. Thank you.